Most people have never actually seen their pores being cleaned, but under a microscope, the truth is shocking. When you zoom in close enough, you can watch oxidized sebum, trapped dirt, and buildup lift straight out of the pore in real time. That's exactly why microscope enhanced blackhead suction has become one of the most talked about deep pore cleansing techniques online. It doesn't just claim to work, you can literally see the extraction happen right in front of you. Blackheads form when excess oil and dead skin collect inside the pores, especially on the nose and cheeks. When that buildup is exposed to air, it oxidizes and turns dark, creating the classic blackhead appearance. And some of these plugs sit shallow, but others sit deeper and become stubborn, making them harder to remove with normal washing or exfoliating. That's where a suction device paired with a microscope camera changes everything. Instead of guessing whether it's working, you can visualize each pore, watch the suction pull debris upward, and adjust your technique instantly. But here's the key: suction devices only help when used correctly. Too much pressure can lead to redness, broken capillaries, or irritation, especially for sensitive skin. The microscope helps you avoid that by showing exactly how the pore reacts at different levels of suction, allowing you to stay in the safe zone while still achieving effective results. It's a smarter, more controlled way to perform deep pore cleansing at home and understand what your skin actually needs. In this routine, we'll go step by step: proper skin prep to open the pores, a real time microscope suction demonstration, choosing safe intensity levels, following up with calming aftercare, and long term maintenance habits that prevent clogged pores from returning. This approach blends education with visuals, making the Blackhead suction hack, microscope pore cleaning, and deep pore cleansing at home both safe and effective for anyone wanting clearer skin. Preparing the skin properly before using a suction device is one of the most important steps in ensuring safe, effective blackhead removal. A lot of people jump straight into suctioning without realizing that the condition of the skin directly affects how much pressure the device needs to use, how easily blackheads release, and how much irritation occurs afterward. Dermatologists always emphasize that the cleaner, softer, and more hydrated the pore is, the more gently it will empty, and the less trauma the skin will experience. Everything begins with a thorough cleanse. When you wash the skin first, you remove surface level oil, sunscreen, makeup, and debris that can interfere with suction. Cleansing prevents the device from dragging impurities across the skin and reduces friction that could lead to redness or lesions. For people with oily or congested skin, a gentle foaming cleanser works well, while those with sensitivity may prefer a cream or gel cleanser. The goal is simply to start with fresh, clean skin, so the device doesn't work harder than it needs to. After cleansing, the next focus is softening the sebum inside the pores. Blackheads are made of compacted oil and dead skin, so the more softened they are, the easier they lift. Using steam or applying a warm towel for a few minutes helps loosen this buildup by gently warming the skin and increasing circulation. This doesn't open the pores, but it does soften the contents inside them, which makes suction significantly more effective. Many people notice that stubborn blackheads release with much less pressure when the skin has been warmed beforehand reducing the risk of over-suctioning. Certain ingredients can make this process even smoother. Salicylic acid is one of the best pre-suction ingredients because it is oil-soluble and can penetrate into the pores, breaking down the debris that forms blackheads. Using a mild 0.52% salicylic acid cleanser a few minutes before suction helps loosen clogged material, so the device doesn't have to rely as heavily on physical force. Enzyme cleansers, like those containing papaya or pineapple enzymes, also gently dissolve dead skin without irritation, making the pore more accessible to the suction. These options help prepare the skin in a chemical rather than aggressive physical way, which is why dermatologists often recommend them as part of a safe pore prep routine. Another essential step is proper hydration. Hydrated skin is more flexible and resilient, meaning it tolerates suction better and bounces back faster. When the skin is dry or dehydrated, suction can tug too forcefully, causing redness, irritation, or even tiny broken capillaries. Applying a lightweight, non-comedogenic moisturizer before suction may seem counterintuitive, but it actually helps create a smoother glide, prevents friction, and allows the device to move evenly across the skin. This is one of the most overlooked steps in pre-suction skincare and often the reason many people experience irritation from devices that should be mild. Skipping hydration isn't the only common mistake. Suctioning on dry skin is one of the fastest ways to cause unnecessary irritation. Another mistake is using alcohol-based toners before starting the routine. Alcohol strips the skin, increases sensitivity, and compromises the barrier. The opposite of what you want before applying any physical tool. People sometimes try to dry out the skin before extraction, thinking it will help lift oil, but it actually makes blackheads harder and more compact, working against the process. A good pore prep routine should always set the skin up for success. Cleanse gently, soften the blackheads at home using warmth. Loosen debris with salicylic acid or enzyme ingredients, and protect the barrier with light hydration. These steps reduce how much suction power you need and create a safer, more controlled environment for extraction. Realistically, suction devices are only as effective as the preparation behind them. When the skin is conditioned correctly, the suction feels smoother, the results are cleaner, and the risk of irritation drops significantly. This thoughtful preparation mirrors the approach dermatologists use before performing any always soften, support, and protect the skin before working on it. When you pair a suction device with a magnifying microscope camera, it completely changes the way you understand what's happening inside your pores. Most people only see blackheads from the outside, but when you look at them under magnification, the entire structure becomes visible. The oxidized plug sitting at the surface, the lighter colored sebum beneath it, and the actual walls of the pore surrounding the buildup. This close-up view is what makes microscope blackhead removal so fascinating and so educational. You're not guessing whether the suction is doing anything. You can watch the debris lift out of the pore in real time, frame by frame by frame. Under magnification, blackheads no longer look like tiny dots. Instead, you see tubular plugs made of compacted oil and dead skin cells. The top portion is usually dark because of oxidation, while the deeper portion often appears yellowish or white. Sometimes you can see sebum fibers, thin, waxy strands that sit inside the pores and contribute to congestion. The microscope captures every detail, even the way the pore walls slightly contract once the debris is lifted. This visual clarity is why so many people feel more confident using suction devices when they can see exactly what is happening beneath the surface. Um, the suction device works differently compared to manual extraction. Instead of applying targeted pressure from two sides, like with Comedo 1 extractors, suction gently pulls upward, encouraging the contents of the pore to move toward surface. Under the microscope, you can see how the vacuum pressure grips the blackhead and stretches it slightly before it releases. This upward motion can be gentler for some skin types because it avoids pinching or squeezing the surrounding tissue. The footage also shows how suction helps remove looser debris around the pore, not just the core plug. Not all plugs behave the same way. Some blackheads slide out instantly, almost like a soft string of sebum lifting with no resistance. These are usually newer blockages or pores that were softened properly during prep. Others hold on more tightly, especially if the debris is older, drier, or more compact. These resistant plugs may only partially lift on the first pass. Under magnification, you can see when a blackhead is starting to rise but hasn't fully detached, helping you decide when to continue and when to stop. This prevents overworking an area or applying unnecessary pressure. The microscope also helps you understand what not to do. For example, when too much suction power is used, you can watch the skin pull upward more than the debris itself. This is a sign the setting is too strong. Gentle suction should lift the plug, not overly stretch the skin. Real-time pore cleaning footage makes it easy to see the ideal balance between suction strength and skin tolerance. If you continue with high pressure, the microscope will reveal redness building quickly, indicating irritation is beginning. This kind of feedback allows people to stay within safe limits. Despite the impressive visuals, there are still limits to what suction devices can do. They're excellent for loosening and lifting soft to moderate plugs, clearing excess oil, and cleaning pores that are already softened. They are less effective on very deep, hardened, or cystic blockages, which require professional treatment. The microscope helps set realistic expectations because you can clearly see the structural differences between an oily blackhead and a deeper congestion that won't budge. It also reinforces that suction should not replace proper skincare or professional extractions for severe cases. When used correctly, the combination of magnification and suction becomes a powerful educational tool. You learn how your pores respond, how much pressure your skin can tolerate, and which plugs are ready to come out. The method also builds awareness of overall skin health by showing what happens inside the pore when the surface looks normal. This is why pore magnification cleaning and suction device results have become so popular. They bring a level of transparency and control that traditional methods don't offer. The real-time visuals make the process safer, more precise, and far more satisfying for anyone working toward clearer skin. Using a suction device safely is all about controlling pressure, timing, and technique. Many people assume stronger suction means better results, but dermatologists consistently explain that excessive pressure creates more harm than benefit. The goal is to lift debris from the pore, not to pull aggressively on the skin itself. A safe suction technique starts with understanding your skin type. Sensitive or thin skin should always use the lowest setting because these skin types are more prone to redness, broken capillaries, and surface irritation. For oily or thicker skin, a moderate setting is usually tolerated, but even then, the device should never feel painful or overly forceful. Suction should feel like a light pull, not a tug. Another important point is avoiding any dragging motion. Many Pore vacuum tutorials online show people sliding the device across their face, but dragging can create micro tears, break down the skin barrier, and even leave temporary track marks. Instead, the device should be lifted and placed gently onto each area of the skin. Staying still allows the suction to work directly over the pore rather than pulling the surrounding tissue. A dermatologist-approved suction method always avoids friction and movement that could irritate the surface. Timing is just as important as pressure. You should never hold the suction on one spot for more than 1 to 2 seconds. If the blackhead doesn't lift in that time, applying longer pressure won't help. It will only cause redness. Moving around the face in short, controlled placements prevents excessive stress to any single area. The microscope view can be helpful for this because it shows exactly when the pore empties or when the device is simply pulling at the skin without progress. As soon as the pore looks clear or the suction stops lifting debris. Comparing suction to manual extraction reveals both strengths and limits. Suction is helpful for loosening oil, removing softer plugs, and clearing multiple pores quickly. Deep axle minimizes the pinching forcing forces in can sometimes be harsh on sensitive areas like the nose. However, suction is not as precise as a comedone extractor for deep or hardened blackheads. Manual extraction allows direct pressure around a stubborn pore, while suction lifts more surface level congestion. This is why suction is often better for maintenance, while manual extraction or professional help may be necessary for older, deeply impacted blackheads. Using both methods appropriately can lead to clearer skin without overworking it. One of the biggest concerns with suction is bruising. Bruising happens when the suction pulls too forcefully on delicate blood vessels beneath the skin. If you notice immediate mild redness is normal and usually fades within minutes, but deeper bruising indicates the pressure was too high or held for too long. To avoid bruising from pore vacuums in the future, always test suction strength on your arm first, and slowly increase if your skin tolerates it. If your skin shows signs of stress quickly, it's a sign to stick with low settings and shorter placements. If the skin turns red after suction, applying soothing ingredients can help reduce inflammation. Aloe, niacinamide, Centella asiatica, or a light hydrating gel can calm the area without clogging pores. Avoid retinoids, scrubs, or strong acids immediately after suction, as these can overwhelm the freshly worked skin. Mild redness is expected because suction temporarily increases blood flow. But if the redness is accompanied by heat, tenderness, or swelling, it's best to pause all extraction and focus on healing. The safe suction technique relies on using the least amount of pressure needed to achieve results, keeping movements controlled and respecting the limits of your skin. When used properly, suction can be a valuable part of a deep cleaning routine. Storaz, has your what? But the moment it causes discomfort, bruising, or persistent redness, it's a sign to adjust your approach. The combination of gentle method, correct settings, and careful observation ensures that suction stays both effective and skin friendly. When you watch blackhead removal under magnification, you finally see what's really happening on the surface of the skin, something you could never catch with the naked eye. The microscope reveals every texture, every pore lining, every oxidized plug, and every movement of sebum as it's lifted upward. What looks like a tiny black dot in a mirror transforms into a detailed, multi-layered structure when viewed close up. This is why microscope pore footage has become so popular. It shows the truth of what's inside the pores and how the suction device interacts with it. Under magnification, sebum plugs look surprisingly complex. Uh, Instead of being just a black dots, you see the oxidized surface sitting at the very top. Mm, Firmer and slightly rough. Beneath that, the rest of the plug often appears pale yellow or creamy white. Some plugs look like smooth cylinders, while others appear twisted or irregular depending on how long they've been stuck inside the pore. You may also see tiny sebum fibers, almost like soft strands, that cling to the sides of the pore walls. These fibers are what form persistent congestion, especially around the nose, where oil production is higher. A successful removal is unmistakable in real-time microscope footage. As the suction engages, you can watch the pore wall stretch gently while the plug rises upward. You rises upward. Flow did often begins with a subtle lift at the oxidized tip, then the rest of the plug slides out like a soft filament. Sometimes it releases suddenly, almost like a small snap, as trapped air and oil shift. Immediately afterward, the pore looks significantly clearer. The dark tip is gone, and the interior appears lighter and clean. In many cases, the pore even looks smaller because the pressure of the plug stretching the pore opening is finally relieved. While pores don't permanently shrink, clean pores reflect light more evenly and appear tighter because there's no debris distorting their shape. Okay. One of the most interesting parts of microscope pore footage is seeing how different pores respond. Some empty in one smooth motion, others release in segments, some barely move at all because the plug is too deep or hardened. This visual feedback helps viewers understand why results vary across the face buff. It also shows when the suction device is actually working versus when it's just irritating the skin. When the device is effective, you see movement inside the pore, the surface plug rising or surrounding debris loosening. The skin stays relatively calm with only mild pinkness. When the device is not working correctly, the camera captures clear signs the skin pulls upward more than the debris, meaning the pressure is too high or the pore isn't ready. Instead of movement inside the pore, you see the surface turning red quickly, showing that the suction is stressing the capillaries rather than lifting oil. If the pore walls look strained while the plug doesn't budge, it's a signal to stop or lower the intensity. In some cases, you may even see slight swelling forming around the pore, another indicator that suction is exceeding what the skin can tolerate. Instant pore cleaning results are most obvious when the footage shows multiple pores clearing back to back, up, back. After a series of successful extractions, the skin under the lens looks smoother, brighter, and less congested. The reflective quality changes. Clean pores have a softer, more even texture, while clogged pores appear shadowed and uneven. This transformation is especially noticeable on the nose, where blackheads cluster tightly. Seeing those dark tips disappear one by one creates a clear before and after effect that's visually satisfying and educational. The microscope also reveals patterns in skin health. For example, if many pores contain soft, pale sebum, it indicates active oil production but easier extraction. When pores hold darker, compacted plugs, it suggests buildup that has been sitting for a long time. These clues help viewers understand how lifestyle, skincare habits, and prep routines influence what's happening beneath the surface. Real time footage brings transparency to the process. It shows what proper suction technique looks like, what genuine blackhead removal under magnification reveals, and how to distinguish safe extraction from irritation. This perspective turns the cleaning process from guesswork into a clear data like experience, helping people improve their skincare routine while seeing the immediate impact on their pores. After using a suction device, the skin enters a sensitive, vulnerable phase where the right aftercare can make the difference between smooth, calm results and redness or re-clogging. The moment blackheads are removed, the pore is temporarily open and the surrounding skin is slightly stressed from the vacuum pressure. This is when soothing, hydrating, and protective steps become essential. Dermatologists always emphasize that what you do after extraction is just as important as the extraction itself because freshly cleared pores behave differently than normal skin. Soothing ingredients are the first priority. Centella acetamide, Centella asiatica, and aloe vera all have calming effects that help reduce the inflammation triggered by suction. Niacinamide helps strengthen the skin barrier, decreasing sensitivity and preventing water loss. It also balances oil production, making it less likely for pores to fill up again quickly. Centella asiatica reduces redness and accelerates recovery, especially helpful if the suction left behind mild irritation. Aloe provides cooling hydration and brings down heat in the skin almost immediately. When applied right after suction, these ingredients work together to stabilize the skin so it doesn't flare up, sting, or become overly reactive. Hydration is crucial because suction temporarily stretches the pore opening, pulls moisture from the surface. When the skin is dehydrated, the pores don't contract as efficiently, and the barrier remains slightly weakened. Hydrating the skin with a lightweight, non comedogenic gel or moisturizer gives the pores the support they need to settle back into place. Well hydrated skin also resists environmental buildup more effectively, which helps prevent blackheads from returning too quickly. A hydrated pore stays more flexible and less likely to trap oil, while a pore while a dry pore hardens and compacts debris, recreating congestion. Once the pores are clean, the focus shifts to preventing reclogging. After suction, the skin produces oil a bit faster as part of the natural recovery process. If this oil mixes with leftover debris or heavy products, blackheads can reform faster than expected. Using gentle, breathable skincare is key during the first few hours. Lightweight serums, Hydrating gels and calming creams help protect the pores without smothering them. Avoid thick occlusives, pore filling primers, or heavy makeup immediately after extraction because they can slip into the freshly cleared pores and undo the work you just did. Keeping the skin clean and simple allows the pores to recover without interference. There are also several things dermatologists recommend avoiding for at least 24 hours. Retinoids, scrubs, and strong acids should all be put on pause because the skin is already stimulated from the suction. Adding extra exfoliation right afterward can lead to overprocessing, resulting in burning, flaking, or prolonged redness. Heat exposure should also be avoided. That includes hot showers, saunas, steam rooms, and even intense workouts. Heat dilates the pores and increases blood flow, which can worsen irritation or make the skin stay red longer. Sweating can also be a problem because sweat can carry salts and impurities back into freshly opened pores, increasing the chance of clogging or inflammation. Um, Another important part of post-suction skincare is keeping your hands off your face. The pores may feel smooth and tempting to touch, but oils and bacteria from your fingers can irritate or contaminate the area. Let the skin settle naturally. If you need to apply products, use clean hands or a sanitized tool. If redness occurs after suction, applying a calming gel or cold compress can help reduce heat and swelling. Mild pinkness is normal and typically fades within a few hours. But if the redness becomes warm or uncomfortable, gentle cooling steps make recovery faster. Most people see their skin return to normal texture and tone quickly when they follow a thoughtful post suction routine. Following proper aftercare not only soothes the skin, but also prevents blackheads from returning too soon. Clean pores behave differently from congested pores, and with the right support, they stay clearer longer. Calming ingredients, hydration, and avoiding irritation give the skin its best chance to recover. Stressful for your skin. A long-term routine for keeping pores clear should never rely on constant suction. Suction can be a useful tool, but dermatologists consistently explain that true blackhead prevention comes from daily habits that support healthy exfoliation, oil control, and barrier strength. When the skin is balanced and regularly shed of dead cells, it forms fewer plugs in the first place. A suction device then becomes an occasional maintenance step rather than the primary method. This approach protects the skin from irritation and gives you longer lasting clarity with far less effort. One of the most important pillars of long-term blackhead prevention is consistent use of salicylic acid. Salicylic acid penetrates into the pore lining, dissolving the mixture of oil and dead skin cells that form blackheads. Using it once or twice per week in cleanser or serum form helps keep pores clear from within. For oily skin, a stronger leave-on serum may be ideal, while sensitive skin often does better with a low percentage cleanser. Over time, salicylic acid reduces the buildup that suction normally targets, making extractions faster, safer, and less frequent. Retinoids add another powerful layer of prevention by regulating cell turnover. They help pores shed dead skin more efficiently. So, Clogged have less chance to form. Retinoids also reduce how sticky the cells are inside the pore, which prevents deep congestion in future blackheads. Even using a retinoid 2 or 3 nights per week can dramatically reduce how often you need suction. The pores remain clearer for longer periods, and the skin overall becomes smoother and more refined. Retinoids work slowly but steadily, giving long-term results that no suction device can replace. Proper moisturizing might not sound like a pore care strategy, but it's essential. When the skin becomes dehydrated, it often compensates by producing more oil. Excess oil increases the likelihood of congestion, meaning blackheads reappear faster. A lightweight, non-comedogenic moisturizer keeps the skin barrier strong and stable, preventing the overproduction of oil while maintaining smooth texture. Well-hydrated skin also tolerates exfoliants and retinoids better, reducing irritation and making your long-term routine easier to maintain. Safe suction frequency is another key part of a healthy pore care system. Using suction more than 1 to 2 times per week can lead to redness, bruising, and long-term sensitivity. The skin needs time to recover after each session, and overusing suction can trigger inflammation that eventually worsens congestion. When done correctly, suction is a supplement, not foundation. In and twice per week for oily skin keeps the skin safe while still giving you the benefits of deep cleaning. Clay masks are excellent at absorbing excess oil and pulling impurities from the surface. Using a clay mask once or twice weekly reduces congestion and keeps pores visibly tighter. Silicone pore brushes provide gentle, non-abrasive cleansing that helps remove surface buildup without irritating the skin. They're ideal before salicylic acid or retinoids because they ensure the skin is clean enough to absorb these ingredients effectively. Oil cleansing is another useful step for long-term maintenance. Many blackheads form because thick or hardened oils sit in the pores for too long. Oil cleansers dissolve this buildup, making the skin less reliant on suction. They work particularly well for people who wear makeup or sunscreen daily because they break down residue that might otherwise contribute to congestion. When paired with salicylic acid and retinoids, oil cleansing strengthens the entire pore care system. The long-term goal is a balanced routine where each step supports cleaner pores naturally. Exfoliation loosens buildup, retinoids prevent deeper clogging, moisturizers protect the barrier, and suction becomes an occasional tool rather than a constant habit. This dermatologist-style maintenance routine keeps pores clean without putting stress. When all the pieces work together, blackheads form less often, extractions become gentler and easier, and your skin maintains a smoother, more refined texture over time.